Howdy, everyone. My name is Sam Wickham. I'm a leader on the mental health justice and economic justice teams at One Northside in Chicago, and I'm a proud member of People's Action. It is my distinct pleasure to be here with so many like-minded folks today. Thank you all for showing up and for bringing your energy, your power, and your heart to this place. It is my sincere hope that all who can hear me and see me are well and taking care, and that your networks are also safe and well. We're going to be getting started shortly. Feel free to use the chat feature to connect with each other and with us. Let us know where y'all are from and what is helping you get through this particular moment. There are folks on our team who are watching chat, so don't hesitate to drop questions or shout outs or whatnot in there, and we will do our level best to address them. We are together today to share space and to talk about what we can do in this time of global crisis to continue to advance our long-term agenda for our country and our world. As people all over the US finally wake up to the fact that this current political system is indeed rigged against us, we are in the unique position of having a clear vision of the future we want to live in. And it does not include fat corporate bailouts. It does not include millions of people struggling for basic necessities. And it does not include our people dying in the name of corporate profit. It does, however, include joy, abundance, and community for all. And we want others to share our vision with us. People in our networks, our neighbors, and certainly our elected officials. To that end, please, if you can, take a moment now to share this live stream and continue to invite your folks into our space here today. Now it's my pleasure to introduce to y'all Connie Nguyen. She's the People's Action Healthcare for All campaign director, and she's coming to us today from Southern California. Connie is grounded in her power, has an excellent sense of where we want and need to go as a country in terms of healthcare, and she's hella good people. Take it away, Connie.
Thanks so much, Sam. All right. Hey, everyone. This is so exciting. We have so many people joining us today. I saw Chicago. I saw Milwaukee, New York in the house, Hattiesburg, Houston. So awesome to have you all here. Again, my name is Connie Nguyen. I'm the Healthcare for All campaign director at People's Action. And for those joining us for the first time, welcome. People's Action is a national network of state and local grassroots power building organizations, and we're fighting for justice with the multiracial poor and working class. And if you didn't know before COVID, you know now that healthcare is a fundamental human right. And I know this from firsthand experience, just like many of you out there. My mom didn't have healthcare until she qualified for Medicare at 65. That led to really bad heart disease that went undetected until she had a heart attack. Thankfully, she survived, but just a couple of weeks ago, she was worried she was going to have another one, so she went to the ER. So our family was up for hours in the middle of the night, nervous about her visit to the ER in the middle of a deadly pandemic. And it's just one example of how the health of one person impacts others. And in this pandemic, we see clearly how the health of others impacts us all. And that's what brings us all here today. As individuals, we're making our best efforts to love and care for one another, despite the distance and the hardship we're all going through collectively. We want to recognize and celebrate that. We want to talk about how we go beyond that. Some of you may be feeling helpless or hopeless, and we want you to know that you're everything but that. We have serious opportunities before us to not only help us get through this pandemic, but to shape the future ahead of us. We all know that we need large-scale action to meet the scale of this crisis. And it's up to us to be clear about what that is and to proudly call for it. So once again, I want to welcome everyone who's here today. Here's what we're going to do. We're going to celebrate the ways we're all taking care of one another right now. We're going to hear from people who rely on our healthcare system. And we are so excited to hear from two experts, Dr. Abdul El Sayed, public health expert, among many other things, and Stephanie Kang, the health policy advisor to Congresswoman Pramila Jayapal. And at the very end, we'll have an opportunity for all of you to take action at home, to take our collective care to the next level. So without further ado, I'm going to flip the feed over to Maya Sastran. Maya is a leader with the mental health justice team at One Northside in Chicago and People's Action.
Thank you, Connie. So, hey, I'm Maya, and I'm the leader with the mental health justice team at One Northside in Chicago and People's Action. Fighting for a better healthcare system is important to me because even with insurance, I'm still struggling to get the healthcare I need at the moment. I was supposed to get my wisdom teeth out actually recently, but because of lack of money and insurance issues, this is still being delayed and causing pain. I shouldn't be in pain right now just because I have shitty insurance. We should all be able to get the care we need. I'm also a person living with mental illness, and there was a time when I lacked the mental health care I needed, and that was extremely debilitating for me. Right now, I have a diagnosis, and I'm on the right treatment, but this wasn't always the case. Years ago, I went without the correct diagnosis for 7 months and was getting worse every day until it got to the point where I lost so much weight, was not sleeping for days, and was barely even eating. And all through this time, I was trying to find a doctor who could help, but keep being told that there was really long wait lists and being seen. They were not okay with me, but things were not okay with me, but I still couldn't get the help I needed, and let it be getting worse and worse. After 7 long months, I was finally connected to the care I needed and got on the right medication, but I've since struggled to access the mental health care I needed because of insurance issues. I've had to bounce around from therapist to therapist, which had created a barrier to making progress. And all of this happened because of this crisis. And it's clear that healthcare systems were not working before at all, and it's now obvious that we need to fix it. I know many people across the country are facing similar situations and are unable to access the physical and mental health care they need right now. This crisis has shined a light on the importance of healthcare and the importance of community care. We have seen how our communities have stepped up to take care of us and the ways our systems are failing us. We've seen people making sure folks in our community have enough food, people creating phone trees, checking on their neighbors, friends are hosting with parties, watch parties and tournaments online. We've seen families spending more time together and staying in touch through this crisis. And there are more mental health hotlines running for those who need it. Neighbors are organizing mutual aid funds to deliver supplies and resources to community members. People are shouting out healthcare workers and boosting them up on social media. People are recognizing the essential workers who are keeping our community running, like grocery store workers and other people on the front lines. YouTubers and celebrities are creating COVID relief funds. Food banks are adapting and ensuring people can still access the food they need. Teachers are pivoting to distance learning. Service providers are sheltering people who are unhoused. Community members are sewing masks for themselves, families, and workers. So, all that said, how are you seeing your community care for one another? Share your answer in the chat so that we can see how we are supporting one another. This crisis is impacting our communities in both negative and positive ways. We are clearly seeing the gaps in our social safety net, and we are seeing our communities stepping up to try to fill in what the government can't or won't do for us. Because of this, the healthcare crisis is bringing people together on a scale we haven't seen nationally, and this is powerful. And now, with all that said, I'm going to pass it on to Emily Jones from Michigan United. Thank you, everyone.
Thank you, Maya. Hey, everyone. My name is Emily Jones, and I am a leader from Michigan United and People's Action. We have a special guest coming up next, but first I wanted you all to know why I am such a big supporter of his. You see, my mom raised me and my two sisters as a young single mother in Flint, Michigan, living just below the poverty line. Financial struggle forced my mom to prioritize healthcare for her children, a sacrifice we still expect women to make. Thanks to my mom, I've had the ability to have access to healthcare for the majority of my life, but it's become a challenge more recently. When I was a sophomore in college, I found out I had fibroadenoma tumors in both of my breasts. When I went to the doctor to get another biopsy, I was told my health coverage expired and I would not be able to see the doctor unless I paid out of pocket. My heart started racing and I felt embarrassed asking my mom if she could afford to help me. I saw her look of shame when she had to watch her child decide whether to cancel a needed medical appointment. Most recently, I did not have the renewal paperwork for my insurance and found out that I did not have coverage as the pandemic reached our state. My sisters also lost their Medicaid due to my mom making just above the threshold for them to qualify. And now, my family is living in a constant state of fear. My sister is at high risk for COVID with asthma, my mother is an essential worker, and none of us are insured. These experiences are the reason I cared so much about getting Dr. Abdul El-Sayed elected as governor in 2018. Abdul fought for working class families when he ran in 2018, which is something we rarely see from elected officials. This work has been a sign of hope for my family and friends, and his campaign has motivated me to keep fighting. Dr. Abdul is a physician, epidemiologist, public health expert, progressive activist, and chair of South Palm, Michigan. Prior to running for governor in 2018, he served as health commissioner in the city of Detroit. He also served as a Bernie surrogate and is now a CNN contributor advocating for a future based on our values. His work has inspired so many folks in Michigan and across the country, and it is an honor to welcome Dr. Abdul El-Sayed today.
Emily, thank you so much. And first and foremost, thank you so much for sharing your story. I'm really sorry that we live in a society where you have to worry about things like this in the middle of the greatest pandemic we've seen in over a century. And I just also want to say thank you to everyone who's joined, and in particular, thank you to all the great folks at People's Action, bringing us together to talk about collective action in the face of the catastrophe we are seeing with healthcare and the work that we need to do to take it on.
Thank you so much. I really appreciate that. And we appreciate your time with us today. You've had quite a journey to being a public health expert and a public figure that you are today. What inspired you to enter the field of health?
Yeah, thank you for asking the question. I come from a really uncommon family. My father is an immigrant from Alexandria, Egypt. My stepmom, who raised me, is a daughter of the American Revolution. And so every summer, I would leave my suburban home in Detroit to go to Alexandria, Egypt. And there I'd hang out with my grandmother, my grandfather, aunts and uncles and cousins. Now, my grandma in Egypt is one of the wisest, most intelligent people I've ever met, but she never got to go to school. She raised 6 kids. 8 she gave birth to, 2 died before the age of 1. And for me, she'd always have this ability to just find moral truth. And when I'd be there in the summers, she'd take extra care to sit me down and remind me just how profoundly lucky I was to be growing up in a place where I could take my education and my health for granted, growing up in an upper middle income home in a suburb of Detroit. In those 15 hours it would take me to go to Egypt, I'd be traveling 10 years difference in life expectancy. But the fact of the matter is that I could travel 25 minutes south and travel the same 10-year life expectancy gap into any neighborhood in Detroit. And so for me, thinking about my grandmother's experience losing 2 babies before the age of 1, thinking about that 10-year life expectancy gap, thinking about the responsibility I had to the privileges I could take for granted, it motivated me to do something about it, to take on health disparities. And I decided to go to medical school because I thought that was the way that I was going to be able to do something about it, only to appreciate that the healthcare system that I was being trained to work in was in fact part of the problem. And so I moved out of clinical medicine into epidemiology, and my research as a professor focused on health disparities. But I also realized that, we could talk all day about a problem. It's a very different thing to solve it. I had the opportunity to rebuild Detroit's health department as health commissioner, taking on that role in 2015. And we did some really important work, made sure that every kid in the city of Detroit had a guaranteed pair of glasses delivered at school within 2 weeks of a vision test. We took on some of the biggest corporate polluters in the state. We made sure that our kids were going to school in safe and healthy places, that they weren't being exposed to lead that we were hearing about just 50 miles north where you're from in Flint. And I realized, though, that so much of the work that we could not do had a lot more to do with the politics that was driving the discussion rather than the technical capacity to do it. And that's when I decided to run for office. And so my pathway into a career in health has really been motivated by thinking about just how profound the differences in experience of health and healthcare are based on all of the other structures, all of the other determinants of people's well-being. And that's also the thing that led me into politics. And I think these two are really juxtaposed in ways that I think organizations like People's Action understand and embrace the responsibility to move our collective values so that we are putting the healthcare and the well-being of folks all over this country to the fore and asking, how are all these choices shaping that?
Thank you so much for that. I didn't realize the roots that you had in healthcare, and it's really nice for all of us to get to know that side of you. So now let's dive in about COVID. So right now we are with lots of people watching from home because that's where we're told we should be for our own health, but also for the safety of our communities. So can you tell us, how did we get here?
Yeah, I think about a pandemic kind of like a fire. If you see the toast in your toaster burning, it may be on fire and you want to put it out when it's in the toaster. Because if you don't, then it may move beyond the toaster. It may engulf the whole house. And if you can't put it out at the house, well, then it's going to engulf the whole neighborhood. We are facing a pandemic that is the equivalent of a 4-alarm fire that's now taken on our neighborhood. And worst of all is that the reason it went from being a toaster fire to a 4-alarm fire is because we basically did the public health equivalent of taking the batteries out of the fire alarms and furloughing our fire station staff. So we don't have any firefighters. We didn't have the fire alarms ready. And so the way you take on a pandemic is to prevent it in the first place. That's the hard part about public health. It's all about doing the things before something bad happens. And we have seen a cut consistently of our public health institutions at the local, state, and federal levels. And these have created the circumstance within which we now went from an emerging virus in Wuhan, China, into a global pandemic that we're all trying to take on right now. What's worse, though, is that the lived experience of the pandemic really does speak to the circumstances in which this pandemic occurred. Not only has our governing consensus told us that we ought to be cutting funding for basic collective action for public health, but also it has created an economy that has left so many people so fundamentally vulnerable to this pandemic, whether it's folks who don't have healthcare at all, or even folks who have health insurance, but see their healthcare behind a paywall for more than half the year because deductibles are so expensive. Whether it's the fact that people who would have been working jobs with clear benefits are now working gigs without them. The fact that, staying at home itself, which is what we all have to do now that we're trying to take on a pandemic rather than just a toaster fire, that itself, staying at home is a privilege because not everybody can do it. If you're a low-income worker in this country right now, you're being forced to go out in the middle of a global pandemic, and you're choosing between saving lives or saving your livelihood. And nobody should have to make that choice. But that speaks to the vulnerability in which this pandemic hit and the circumstances in which we find ourselves right now.
Yeah, thank you for that. I know that your insight in this crisis has been very valuable to me, and I'm sure lots of others that have followed you along with this. So that does bring me to my next question. We all know that the virus does not discriminate, but it is hard to ignore the stark reality that communities of color are being hit hard by this virus. And here in Michigan, the population of Black folks is 14% of our overall population, but Black folks make up 41% of COVID-related deaths in the state. Why is this happening?
Yeah. Viruses don't discriminate, people do. And the fact is that when as an epidemiologist, when I think about an epidemic, we all focus a lot on the pathogen, but that's only 1/3, not even, of the formula. It's also about the host and about the environment. And if you think about the circumstances in our country, we have watched the environment replete with loads of structural racism, making choices about patterning access to everything from an education to healthcare, to a good job, to a living wage, to a community, to clean air, clean water, that environment and its structural racism has been beating up on the host for a very long time. And you see that marked in the bodies of people. All the pre-existing conditions that we know portend a bad outcome with COVID-19, things like asthma, diabetes, hypertension, heart disease, all of these are in higher incidence in Black communities. And so if you look at what happens now when a pathogen rolls through in the middle of a global pandemic, it's going to follow this well-worn social physics to find the most vulnerable people in our society. And those people, those hosts, are so much more vulnerable because of the circumstances within which we have forced people of color to live for a very long time. And so, everybody throws up their arms when they see these outcomes and they're so surprised. these outcomes are not surprising to anybody who's looked at health and disease patterns in this country since the beginning. But they are astounding and they're shameful. And the question I think we have to be asking right now is, are we willing to do the work to repair the structural indignities in which we force people to live so that something like this doesn't happen? Because it happens with every outcome you look at. An outcome I already talked about, infant mortality, the death of a baby before the age of 1. The communities that are hardest hit with COVID-19 are also the ones that are hardest hit with infant mortality. Now, these two outcomes pathophysiologically could not differ more. But when you think about the social pathophysiology of them, the social creation, right, you see the same roots that emerge out into the same awful fruit in terms of differences in health and disease by race. And so we've got a lot of work to do to be solving it. And I'm grateful to organizations like this who have been talking about these issues even before they made national headlines.
Yeah, thank you for that. It definitely hits, home for me as well, with so many cases being in Genesee County and in the Flint area. So I really thank you for that insight. So I know for me in 2018, your campaign animated so many young people, especially myself. And while healthcare is extremely important, young people are often forgotten when we talk about fixing our broken system. So what are the best practices that you have from your campaign or from your work of ways that we can bring young people into this movement?
Well, I'll say a couple of things on this front. First of all, thank you so much for your support. It means a lot to me. And, I wanted to run a race that was focused on our future. And the literal manifestation of our future is young people, right? I mean, just run the numbers, right? You got on average longer to live, more time that you have to spend in this place. And so we've got a responsibility to invest in that. Now, the hard part, right, when we think about young folks, there's been a lot of conversations about, well, young folks don't come out and vote, et cetera, et cetera. And I think it's never been harder in this country for a very long time, right? At least 50 years to be a young person in America. You think about, I'm not particularly young. I can't really call myself a young person anymore, although, that's debatable. My cohort, who were privileged enough to go to college, they graduated into the greatest recession since the Great Depression. And then 10 years, 12 years on, now, right, I got a 2-year-old, we're raising our kids through the worst pandemic in 100 years. And you ask yourself why, right? And it's easy to point at any one of those things and say, well, it's just a coincidence. Well, it's not. No, it is the consequence of a systematic governing consensus that tells us that we should be stripping away the basic dignities that government ought to provide, right? And that it's okay to create an economy where the wealth and the power funnel up, right? And the loss of opportunities and the loss of power funnels down to everyday folks. And so this is one of the hardest moments, I think, to be a young person. So my point on that is, number one, we've got to call it out when we see it. It is not about a generational conflict as much as it is about an honest assessment of what the consequences of our politics and our policy has been for a number of years. And then B, I think we have a real responsibility to speak of hope. And I know that that can sound Pollyanna-ish, as we're all, if we're lucky enough to be in our homes, we're in our homes in the middle of a huge pandemic. But every day I wake up and I get to look at my baby girl. She's 2 years old now. And I think about the world that we owe her and the kind of world that she wants to live in. And I ask myself, what is the responsibility to build that out? And I think young people recognize that, right? There is an implicit hope in young people. You haven't been beaten down by the world. And I think we've got a real responsibility to lead with that hope. And I just recently released a book. It's called Healing Politics. And in the end, I talk about this idea of empathy politics, the responsibility to look into someone's experience and ask, how would I feel if I put myself in their shoes? What would life be like to live where they live? And I think the beautiful thing that young people always add to our politics is a sense of optimism, because the reality is when you're young, you've never been old before. But if you're old, you've been young. And I think if you can think back, right, and you can talk to your experiences about what it's like to be a young person right now, and you're willing to have that conversation with folks who may be in a different stage of life, they know what that's like. And I think if you can just say, listen, here's what I feel as a young person. I'm not so sure about this American dream. I'm not so sure that I'm going to have enough money to buy a house. I'm not so sure I'm going to be able to partner up with somebody and that we're going to be just fine because all of us have $100,000 in debt and we can't even pay for our health care. I think if we were willing to lean in those conversations and have the patience and the empathy to allow people to see where we're coming from, that our public conversation would be a lot more effective, and that we would have the ability to really move forward on some of these policies and the politics that we need to drive them.
Yeah, I couldn't agree more. Thank you for that. I think more and more I'm realizing too how resilient our generation is after so much trauma that we've endured, and so it's great to hear that perspective. So, lastly, from a healthcare or public health perspective, what's next for us? So, what should we expect, and what do we need to do to build a just healthcare system?
Yeah. So let me speak specifically to this pandemic, and then talk a little bit bigger picture. We all know that we've been quote unquote social distancing to quote unquote flatten the curve. And the good news is that by and large, we've done that. And I just want to say that's a collective action. It took all of us deciding that we were going to be a part of this, because we know that this pandemic has shown us that we are all as vulnerable as the most vulnerable. We're all as exposed as the most exposed. The next question becomes, well, are we able to safely come out of social distancing? Will we have the means to do that? Do we have the testing capacity to do that? Do we have the personnel to be able to trace contacts, literally identify every single person who is exposed, and then get them tested and then decide whether or not they need to be isolated? Can we move from mass social distancing to precision social distancing? And then from that, what happens when we do in fact start engaging back in the kinds of practices that make our lives what they are, right? The substrate of our lives is the interactions we share with folks. And what's so hard about this is that social distancing often means social isolation. But one word I didn't use was normal. And the reason I didn't use the word normal is because normal back even before this pandemic wasn't all that normal for so many folks. And I hope that this pandemic shows us that we have a responsibility to embrace the fact that we are all as vulnerable as the most vulnerable people in our society. And we have seen that vulnerability firsthand. Just this morning, I was scrolling through Twitter and somebody had a video of people lining up to get $30 in food credit from megamarts in the DMV area. I want you to think about that, right? And people are just looking at this now, but how often before this pandemic ever happened did people go hungry for lack of food? Did people go sick for lack of healthcare? Did people have to worry about whether or not they were going to be able to keep their job until tomorrow, and if that job even provided them the basic things they needed to put a meal on the table for their kids and put a roof over their heads? These are questions that people were dealing with for a very long time. And even though, right, it wasn't a collective trauma that we were all experiencing at the same time, there were many, many mini traumas that happened every single day. And so the choice that we have from a public health perspective is, what kind of normal do we want to build? Are we willing to embrace a normal where all of us are willing to invest in one another, recognizing that, in fact, we are all as exposed as the most exposed, we're all as vulnerable as the most vulnerable? Are we willing to come out of this moment and build the kind of healthcare system that doesn't leave anybody out? Are we willing to invest in a healthcare system that puts the well-being of the sickest of us and folks who are worried about the security of getting sick in the first place above and beyond the tens of millions of dollars that corporate CEOs are making and raking in off of this current healthcare system? Are we willing to invest in a normal where we don't allow corporations to pretend like they're people, get away with paying no taxes, and then allowing politicians whom they control because of the ways that they've spent on their elections to then advocate for cutting basic social services that would prevent the kinds of insecurities that we're seeing all over our country right now? So I hope that we decide that the abnormal in which we used to live isn't going to be our normal moving forward, that we're going to rebuild our public health infrastructure, that we're going to reform our healthcare system, that we're going to understand the implications of an unequal economy on all of those things and the way that people suffer, and that we're going to invest in the basic dignities that should be commonplace, should be normal in the richest, most powerful country in the world. And so normal is within our making, and I do hope that we are willing to do that work. I'm really grateful to be with you all today because this is an organization that truly is calling our normal to a higher ground of a moral ethic that dignifies all of us. So I'm really grateful to be with you all. And Emily, really grateful to have the opportunity to chat with you.
Thank you so much. I couldn't agree more. And again, we really appreciated your time, and your activism, as I said, has motivated so many of us to keep fighting. So thank you. At this point, I will pass it back to my friend Sam.
Thank you, Emily, and thank you so much, Dr. El Sayed. It's good to have some critical analysis from someone who has expert knowledge of what it is that we are facing. Now we're going to welcome to this space Dr. Rita Simon. Dr. Simon is chair of the healthcare team and the steering committee at Citizen Action Wisconsin Northwest Co-op and has been a physician for many years. She's retired now. She's here today to talk to us about what else we can do to collectively care for one another and build towards the just healthcare system Dr. El Sayed just spoke about. Over to you, Rita.
Thank you, Sam. I'm a family practice doctor who served in a Wisconsin town of 13,000 people and a county rural area. And many of my patients were dairy farmers who often wouldn't to the clinic serious health issues and couldn't take their prescribed medications because they didn't have health insurance. Some folks traveled an hour to our clinic or hospital because there was nothing closer to them for health care. Many of those issues that prevented folks' ability to get health care then are still problems today, which is why I am here. As Maya reminded us, we have all witnessed the tremendous outpouring of care and compassion people have shown for each other as our nation struggles with the challenges of navigating this deadly pandemic. As individuals, we wash our hands and stay at home and check in on each other. Or we organize food drives and sew masks or run errands for high-risk people who are isolating. But another way of caring for each other is by engaging collectively in powerful public political action to advance our shared goals in this crisis. This is just as important as making masks for essential workers or delivering groceries to homebound neighbors. This COVID pandemic has shown us the dark underbelly of our for-profit healthcare system, starkly revealing the inequities in our society. As mentioned, African Americans are dying from COVID-19 in much greater numbers than their white counterparts. Millions of Americans have lost their jobs, causing particularly severe consequences for those who are already living on the edge of food and housing insecurity. Job loss frequently translates to the loss of employer-based health insurance, leaving millions of people very afraid, hoping that they will not have to use the healthcare system for any reason right now. And even folks who do have health insurance are reluctant to get COVID testing or treatment because they worry that co-pays and deductibles and surprise medical bills might ruin them financially. We need federal action that meets the scale of this crisis. Most states are working extremely hard to help their people through this pandemic, but the scope of it is so huge, and states have limited resources. Only the federal government can meet the demands required across this country. We are seeing some federal relief being provided for people and families, but we are also seeing a disproportionate level of bailouts promised to corporations. This is how our government is acting in this moment. Some of it is good, and some of it not so much. We need federal action to meet the scale of this crisis. The federal government must step up to help the people who are most impacted by this pandemic. Millions of everyday people who are the backbone of our economy and society and who are struggling and suffering greatly. Advancements in human rights usually occurs through the grassroots, collective energizing of the people working together, raising the hue and cry to our leaders and to others who think that the status quo is just fine. Individually, we can feel powerless against those forces, but together in great numbers from all across the nation, through powerful public political action, we can make our voices heard. We can push, we can demand, we can affect great change. Our communities are clear about what we need in this crisis and what the solutions are for getting those needs met. Our role is to demand that those who represent us listen to us and deliver on the solutions that we are calling for. We need federal action that meets the scale of this crisis. We cannot turn to the pre-pandemic normal. We cannot go back to a broken, fragmented healthcare system that does not care for all people equally. We can no longer stand for the inequities that exist in our society. We must move forward to create a much better healthcare system that works for all people in the United States, not just for those who can afford it. The time is ripe, right now. The opportunity is here, right now. We must push our legislators to get on board to define and implement a new normal that would be incredibly better than the status quo. Political action as collective action puts us on the path to caring for each other by working together for the changes we all know we need in our society. Collectively, we can be real change makers and have a huge effect so that no matter what catastrophes our country encounters in the future, we will all know that each one of us is equally valued and cared for. By engaging collectively in powerful public political action, we can move the needle of social change to a much better future for ourselves and for future generations. So be the change you want to see. Together, let's do it right here, right now. So next, let's talk about what's needed most during this time of pandemic to help the millions of people who are affected. And we'll also give you opportunities to take powerful public political action right here, right now. And now back to Sam.
Thank you, Dr. Simon. It's really terrific to be able to hear from another healthcare provider that our vision is spot on in this time of dread. You know, in this time of uncertainty and stress, it's important to celebrate our victories, both collective and individual. I would like to ask the question of all who are gathered here. When was the last time you felt powerful? When was the last time you felt like you were in control of your own actions? It can be large or small, life-changing or simply mood-lifting, accomplished completely alone or alongside comrades. What is the thing that you have done or withstood or have caused to happen that showcases your willingness and ability to stand firmly in that place of personal power, of owning your ability to influence or change an outcome? I'll give you an example. My latest powerful moment has been reaching out to our One Northside community to see how folks are doing, what kind of stresses they're under, what they may need that we could provide access to, and how we can lift them up in this time of fear and uncertainty. It has been very gratifying and all kinds of powerful to be able to listen to their truths and speak to our shared humanity. So again, when was the last time you felt powerful? When was the last time you felt in control of your own actions? Please type your answers in the chat so we can all witness them and help you celebrate. And show to each other that there are plenty of moments in the midst of this calamity where we can do more than just keep our heads down and survive. As humans, we are infinitely adaptable. And as activists, we are powerful as hell. Now, I want to take a moment to share a bit of my own healthcare story with you. I have lived with and battled depression and PTSD since age of 10. Due to internalizing the American propaganda of pull yourself up by your own bootstraps, it took me 34 years to reach out and accept that I had a mental illness and that I needed help. At the beginning of reaching out for help, I had private insurance, and I got all the health care that I needed in that moment. Months later, I found myself without insurance, and my experience from that time was vastly different, and it was much more stressful. And that ain't right. People's quality of health care should not be based on what they can pay for, and it shouldn't be tied to their employment status. And that's why we are here today, to fight for a healthcare system that covers all of us, especially at a time when people are losing their jobs left and right. Well, right now, I am pleased and proud to introduce Stephanie Kang. Stephanie is Health Policy Advisor to Representative Pramila Jayapal, one of our champions on Capitol Hill. Stephanie is the lead staffer for HR 1384, the Medicaid for All Act of 2019. And she has a background in global health, coalition building, and implementing community-based approaches in health and education. She's here to speak about the Healthcare Emergency Guarantee Act. Thank you for taking the time out of your busy schedule to be here with us today, Stephanie.
Thank you so much, Sam, and People's Action for organizing this. I really just have to take a moment to really just saying how much gratitude I have to have moments like this. Every day for the last several weeks, I've spent in so much uncertainty and anxiety and just throwing myself into the work so that I'm not dwelling on the realities of what we're witnessing. And having these moments right here, hearing everyone speak, finding myself smiling and feeling that solidarity is so important, because we are all engaged in work that requires us to be able to replenish ourselves. We have to take care of ourselves in order to take care of others. So this is a really, really critical platform, and thank you so much for organizing this. As Sam said, I'm the health staffer for Congresswoman Pramila Jayapal, who's the lead sponsor for the Medicare for All Act of 2019 in the House. And so for the past year, I've been really working closely with our grassroots partners to push Medicare for All prior to this pandemic. And I can't help but reflect and think about how different the situation would have been if we had had a Medicare for All system. And, for my family, they're from South Korea, and to be able to witness just how critical and integral their single payer healthcare system has been in creating a unified, coordinated national response to what is happening is the reason why that they have a population comparable to just Seoul, South Korea has a population comparable to New York City, yet as a country, you only have 200 deaths versus New York City alone having tens and tens of thousands of deaths. And so when you don't have to question that, as a society, you're going to respond and you're going to put people first and that their health security is important, then you don't have to be thinking about a lot of the different questions that we have to be asking in these moments. These problems that we're trying to fix, those are not problems a lot of our other developing countries have to think about, right? They're just thinking about what is the public health response that we need to coordinate. And so, and on a personal level, I've also just been thinking a lot too, because for the last couple months, I was not employed through the office of Congresswoman Pramila Jayapal. So because I wasn't employed, I didn't have health insurance. So from February 1st until a few weeks ago, in the heart of, when this pandemic was surging, I didn't have health insurance. And for my mother, having to file for unemployment and going through that process for the last few weeks. And for my father, who's considered an essential worker because he works at a car maintenance shop and he has a high deductible plan from the marketplace. And so now he's vulnerable. And if he gets sick and he has to try to use this plan, there's just no security, there's no certainty in any of these structures that were supposedly meant to protect us. And so it's been a frustrating last few weeks. So again, this has been a really important moment to be able to come together. And before I go into some of the next steps of what we're thinking about in Congress, I really wanted to just take a moment to celebrate, because I think that's sort of a theme for today, is to celebrate how much we've accomplished just in this past year on Medicare for All, right? So I think it's really important to remember, because I can barely keep track of the days, and it really wasn't that long ago when we were watching Medicare for All have this incredible momentum across the country. And of course, we owe a lot to Senator Sanders for kicking off and bringing it to the national stage, but it's really this grassroots movement that has come along with it, the work that People Action and so many others have done and participated in, that has brought it to this unprecedented level. And, we saw it. Every single debate stage, we saw Medicare for All being discussed. We saw in Congress that they were having hearing after hearing, that we have over half the Democratic caucus on the bill, that we had city councils across the country from Los Angeles, California to Bethlehem, Pennsylvania, passing resolutions in support of Medicare for All. And we saw after every single Democratic primary so far in the exit polls that overwhelming majority want Medicare for All. And this was before the pandemic, right? This is before all of this was happening. And, I don't have to say this to all of you, and this has already been discussed at length through Rita and through Abdul, but, people involved in this work right now, we already knew our healthcare system was broken, right? This pandemic did not break our healthcare system. Our healthcare system was already in crisis. What COVID-19 has done is exacerbated all of those different aspects of brokenness. You know, we already knew that before COVID-19, that as a developed country, we had the lowest life expectancy, that we'd have the highest maternal mortality rates, which is significantly worse for our Black and Brown sisters. We already knew that a majority of this country is one medical bill away from a financial crisis. And so what COVID-19 has done is really just indiscriminately shown how insecure the situation is for everyone. And it's sad that this has to happen indiscriminately before people, find the solidarity to be able to address this. But just to echo what everyone is saying, this is really a moment to reimagine our goals, right? I mean, we no longer have to argue, that this is the progressive ideal, that this is the thing, this is radical, right? What we're talking about is basic, rudimentary, fundamental dignity in all of these aspects. And so while we lay down the groundwork over the next coming weeks, and we have to lay down the groundwork and mobilize and start to really think about how do we ensure that this is the last pandemic that we have to face without a Medicare for all system, we have to think about the now, right? Because unfortunately, the political realities show us we're not going to have a Medicare for all system in the coming weeks, right? And so through the Office of Congresswoman Pramila Jayapal, what we've been constructing are different healthcare bills that have two different avenues. So the first one I'm going to talk about is the one that we're doing in conjunction with Senator Sanders, and this is the Emergency Health Care Act. And what this bill does is that it creates this safety net across the board, right? Because what we're seeing right now is that our most vulnerable populations, let alone people who even have insurance but have crappy and high deductible plans, they're not being protected. And so what this does is you show up at the hospital, you have insurance, you don't have insurance, doesn't matter. You show up, you get the care you need, and it's going to be reimbursed through Medicare. So you don't have to enroll in something, it's just going to be taken care of for the duration of the crisis. And that's just to make sure that across the board, we're seeing as much protection as we can for who you are, regardless of your insurance status. That's very important, and we want to have that safety net for as broad of a group that we can, but we also have to be thinking about what are the structural changes that we can be creating at this time. And so that's why Congresswoman Pramila Jayapal is going to be introducing a bill very soon that focuses on enrolling our recently unemployed. So in the last 4 weeks, more than 20 million people have filed for unemployment. How do we get them into a reliable health insurance program? And so we're seeing some parties suggesting that, oh, why don't you just open up the ACA marketplace, or why don't you just, rely on COBRA? And if, I don't know, anyone who talks about COBRA and wanting to rely on COBRA obviously has not had to actually apply for COBRA, because COBRA is incredibly expensive. A lot of these plans have huge gaps, huge out-of-pocket costs, right? And really, I mean, if you're thinking about this, you're paying for these incredibly expensive plans where people right now aren't using them for their normal services, right? Elective surgeries have been canceled. They're not going to their PCPs like they used to. And so what we're offering is use Medicare to enroll these recently unemployed. Let's start this step and get them into a public health plan that is more reliable. Let's put a cap on those out-of-pocket costs, because Medicare as is not perfect. It has a lot of things to improve. And that's why the Medicare for All Act does try to improve Medicare. But for this bill, it's this urgent step for right now, trying to ensure that we enroll as many people as we can. And so those are the two avenues that we're going through right now. I for the next few weeks, we really are going to be making this push to ensure that in our next stimulus package that we're seeing these the protections being reflected in that stimulus package. And we really, really need your help for that. Congress members and people inside can do as much as they can, but unless people are aware of exactly what people need and what they want, and that this is a major issue for all of you, we don't have the power that we need to be able to ensure these types of provisions. And so those are the sort of general overview of those bills. I'm happy to answer any sort of questions around those bills, because they're a little more complicated than what I explained. But that's what we're working on right now. So.
Thank you again, Stephanie. What a great glimpse into a bill that could definitely propel this country in the right direction. Well, folks, you heard it from Stephanie Kang, Healthcare Advisor to Representative Pramila Jayapal. The Healthcare Emergency Guarantee Act would make it so that everyone in the U.S. could get the health care we need, including medication, during this COVID-19 pandemic. This is the scale of change that our communities need, and the only thing that will, as a basic principle, ensure we can all access the care we desperately need during this critical time. And I'm going to say it. It will help us as a nation confront the systemic racial inequalities that brought us to this calamitous moment where our Black and Brown sisters and brothers, they're dying at disproportionate rates all across the country. So you may be saying to yourself, what can you do to help make the Healthcare Emergency Guarantee Act a reality? Well, we need everyone who is here right now to reach out to your members of Congress and demand that they support this bill. To make that easier to do, we've put together a simple tool for you to use. You should be seeing now at the bottom of your screen a green button that says Pass the Healthcare Emergency Guarantee. So let's everybody click on that button right now as I'm speaking and fill out the form right now. I'll give you just a second, and then I'm going to bug you about it. Did you do it? Did you fill out the form? Okay, great. Now let's send an email to your Congress people. Tweet at them. Y'all love to tweet. We want to flood their inboxes with our words. We want them to hear us and be afraid of not supporting the Healthcare Emergency Guarantee. And then once you're done, please share this action out to your networks and get everyone you know to join in on this action. We're going to give you a moment to do that right now. And I'm going to give you sort of a time pass so that you know how much time is passing and when we're all going to come back. So I'm going to sing for you a little bit. And I apologize if this makes anybody cringe, but I'm going to do the Jeopardy song. Do 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 do. Okay, that was the shortened version of it. Thank you everyone for participating. We just took a massive collective action, and it feels terrific. Big love to all y'all. Because this right here, this is how we take care of one another during this strange and scary time. We suit up and we show up for our fellow humans. All right, now please help me to thank all of our guest speakers today. Connie Nguyen, Maya Sostrin, Emily Jones, Dr. Abdul El Sayed, Dr. Rita Simon, and Stephanie Kang. All right, now don't forget to follow us on social media, because next week we're going to be demanding a people's bailout. No more corporate bailouts. So make sure you follow People's Action on social media to stay up to date on political action as collective care. I also want to shout out to the local organizations that helped put this webinar together. If you're in Chicago, please give One Northside a follow. Woo woo. And if you're in Wisconsin, give Citizen Action Wisconsin a follow. And if you're in Michigan, give Michigan United a follow. We are more powerful when we are connected to each other. And of course, thank you to all of you who joined today and made this event worthwhile. Oh, and a shout out to those of you who shared in chat and took direct action. And to those people on our team who kept eyes on chat and tech and time limits and helped put all this together. All y'all just give us life. This is life, y'all. We are going to get through this. Stay connected to your communities and to each other, and stay tuned to People's Action and your local affiliates for more opportunities to be an agent of change. All right, let's end this little shindig with a sing-along. I seriously want y'all to turn your attention to the closed caption lyrics on your screen. I want you to belt it out like we were all together in a single room. You know how grassroots organizations roll. This is what we do. we're going to do our best today to raise the collective roof. Now, Maya's going to sing for us. Maya, are you there?
Hi.
Hit it.
Broken down and tired of living life on a merry-go-round. You can't find her. I see it in you, so we're gonna walk it out. Oh, mountains, we're gonna walk it out. And mountains, and rise up, rise like the day, rise up, rise unafraid, rise up, and I'll do it 1,000 times again. Yeah.
Thank you, Maya. Excellent job. Yay, us. Great job, everybody. Well, here's hoping we can all take this energy with us as we depart and let it bring us comfort and a deep knowing that we are not alone and that collectively we have the power to make our dreams a reality. So thank you. See y'all next time. Bye.